Okay, Jonah, patient assessment, medical, okay?
Okay.
You're dispatched, you have 15 minutes to complete the skill sheet. You are dispatched to the nursing home for an 88-year-old female that has altered mental status.
Okay.
You arrive on scene. The nurse says that Mrs. Jones has been sick and now she's not acting. She's acting funny.
Okay. Be advised, my scene safe.
Yes.
I'm going to determine my NOI, which is my patient has been acting funny and has altered mental status.
Okay.
I'm also, this is my only patient.
Yes.
Correct? Okay. I'm also, I'm going to ask for additional resources if I need them. And I'm also always going to take into consideration C-spine precautions for my patient.
Okay. You walk into the room. You see Mrs. Jones laying in her bed. She appears to be asleep.
Okay.
You have this strong smell of, stale urine, and you see a Foley catheter with the neon yellow cloudy urine in it.
Okay. My general impression of my patient is poor.
Okay.
Right now, I am going to just stay and play for a little bit, just to get some vitals and kind of get an understanding of what might be wrong with my patient. I'm going to also check for a responsive level.
She's responsive to verbal.
Verbal? Okay. And then my chief complaint right now is just altered mental status for my patient. And then any life threats for my patient at this time?
No.
Okay. I'm going to assess her airway. How's her airway doing?
Airway is patent.
Okay. How's her breathing? Is she tachypnic? What's the rate rhythm quality?
She is tachypnic.
Tachypnic, okay.
She is at 30 a minute.
Okay.
Shallow breathing, bilateral chest rise and fall.
Okay. How's my circulation? What's my pulse like?
Pulse
Rate rhythm
is
quality?
rapid and regular.
Okay. What about my skin? How does my skin look like?
Pale, cool, clammy.
Pale, cool, clammy. Okay. All right. My transport decision right now is I'm still going to stay and play just for a little bit so I can get some more history. When did this start? What's my onset?
So good thing the patient's daughter is there. She says that she always has a Foley catheter in,
Okay.
and that she has trouble with UTIs. She's had a UTI for the last 2 weeks. She's been on antibiotics,
What kind of antibiotic?
Rocephin,
Okay.
and the last few days she's been fairly altered mental. Hasn't been getting out of bed. Hasn't really been eating.
Okay. All right. Any nausea or vomiting or anything?
No.
Okay. Cool. Is there anything that makes it better or worse?
No, she just stays pretty much altered.
Okay. On like a scale of 1 to 10, is she feeling any pain?
She
Sickness
hasn't
level?
reported any pain.
Okay. Well, I'll finish all my OPQRST questions as well. Does it radiate anywhere?
No.
Like pain or the sickness or anything, just kind of staying put? Severity?
My mom's pretty sick.
Okay. And then time, that started, how long ago did you say?
She started acting funny 3 days ago.
3 days ago. I mean, it's definitely not normal for this patient. Okay. Any allergies to any medications?
She's allergic to penicillin and sulfa.
Okay, sulfa drugs. Okay. Any medication she takes other than the Rocephin?
Yes, she takes. She has AFib,
AFib?
so she takes metoprolol,
Metoprolol,
and
okay.
has hypertension, and takes lisinopril.
Okay. Is she diabetic at all?
No.
Okay. I'm still gonna take that into consideration in the future though. And her last oral intake?
I haven't seen her eat in a couple of days.
Okay. Any events, special events leading up to this?
No.
Okay. Well, I'm gonna go ahead and get a set of vitals on my patient as well. I want blood pressure, pulse, respirations, quality of my respirations, I'm also going to ask any additional clarifying questions just to figure out any additional information I might need to know about this patient. I also want a temperature, blood glucose, and I am going to throw my patient on end-tidal CO2 as well. Nasal cannula and tidal CO2.
Okay, blood pressure,
Okay.
70/40.
Okay.
Pulse is 115 AFib.
Okay.
Respiratory
patient-
rate is still 26
Okay.
or 30.
Okay.
They're still shallow and rapid. Temp is 97.5.
97.5. Okay.
BGL is 120, and her SpO2 is 89%
Okay.
on room air.
I'm gonna use appropriate oxygenation for this patient too. I'm gonna put them on oxygen therapy. Right now I'm gonna just start like 4 liters per minute nasal cannula. See if that helps.
Oh, her end tidal is also 30.
30 right now? Okay. Right now, just due to her low blood pressure, I'm going to start 2 large bore IVs in either arm. I'm going to just start fluid resuscitation, 20 milliliters per kilo right now. So I'll start out with that. I have my oxygen going. I'm also going to load this patient to the ambulance right away. I do consider this to be a critical patient.
Okay.
So that's my transport decision. Also, keeping in mind any additional resources I might need. Just due to her blood pressure being lower as well, I'm also going to take into consideration of some sort of vasopressor. So I am going to use Levophed or norepinephrine for this. I'm going to take 4 milligrams, put it into 250 milliliters of D5W, and that's going to come out to 8 micrograms per kilogram per minute for my patient. I'm going to reassess my interventions that I've done for my patient, also reassessing my primary and secondary assessments and my vitals. Do I see any change in my vitals?
Blood pressure comes up. Blood pressure comes up. She's still altered.
Okay.
Respiratory rate's still rapid. Temp is still 97.5.
Okay, any change in my CO2?
No.
Okay. All right. And then I'm going to rapidly transport my patient.
What's going on with this patient?
My field impression on my patient, I do believe, is sepsis,
Okay.
going into septic shock just due to having frequent UTIs and the trending vital signs of my patient as well.
Okay. Is there anything else you'd like to add?
Not this time, no.